Welcome back to Empowerment Nursing. I'm Linda and this is Ashley, and we are nurse educators. You are tuning into our series In the Know, where we make it simple. Today we are simplifying our top 3 tips to pass the NCLEX CPNRE exam.
So we invite you to subscribe to our live videos so you'll be notified whenever we're online. You can also follow us on our YouTube channel. Like and share this video with your nursing friends and follow us on Facebook. And check out our website, www.n-powermentnursing.com, where you can experience our free trial, which is our entire cardiac chapter, as well as view our complete study packages, which you see in front of us here. And now we are going to share with you our top 3 tips to pass the NCLEX or your CPNRE exam. And our tip number 1 is content. In our book, you can see here we have all of the content that's required to study for your registration exam. Whether you're writing the NCLEX, the CPNRE exam, or you're in a bridging program, we do have complete packages for all of those programs. It's really overwhelming to know what it is you need to know to study to pass your registration exam. So our goal was to take that question kind of out for you. We know what you need to know, and we've packaged it and we can ship it right to your door. A lot of students don't want to restudy content. They don't know where to start, right? They don't know what they need to know. Basically, you can't know everything. So our focus is on the core content, the most tested content, the must-know content. You can't possibly know everything. You could study for eons, right? So we know what is most tested and what you absolutely have to know. And we give it to you in a way that is applicable to your registration exam. Within our textbook, you'll find that we do use the most validated study techniques. We are professors of nursing full-time. We use mind maps, side-by-side comparisons, as well as drawing. And these are the best ways to solidify information for long-term and short-term recall. So we're using the best evidence in terms of studying. You absolutely have to study content. That is our number 1 tip.
Awesome. Tip number 2 is critical thinking. Our program is taught in such a way as to promote deep critical thinking so that you understand the content and its interconnectedness between systems. So for instance, the very first chapter is body balance, and in that chapter, one of the very first concepts taught is acid-base balance, one of the most difficult concepts in nursing. And we apply this throughout the book, throughout the respiratory system, the endocrine system, the cardiac system. And so this interconnectedness leads to deep critical thinking. It's taught in a way not only where we review the content, but we demonstrate how it applies in the exam by talking about the application of the content to test questions. We make complex concepts simple to allow you to apply them with an adequate level of understanding to test questions, requiring judgment and prioritization, which is some of the toughest questions on the exam. Mm-hmm. And the exam questions always trace back to content and your ability to critically apply it, demonstrating your competence as a professional nurse. This is the whole point of writing the registration exam, is that you're applying your critical thinking, you're showing that you are competent.
And our tip number 3 is confidence. This is the one thing that most people don't know they require until they attempt to write their exam and they don't have the confidence that it takes. Emotional, and I'm going to take the time to write this, readiness. We talk about it often. We coach people on it very often. Straight A students who do very well in their undergraduate degrees or in their practical nursing programs in the college setting often fail their registration exam, and it's not because of content, it's because of emotional readiness. They weren't in the right mind space to write, they were nervous, they felt pressured, they were unready, whatever case may be, you have to have a plan for test day. You have to have a strategy for what you're going to do when you're writing that exam if you don't happen to know the answer, so this doesn't derail you when you're writing your test. We talk about this in terms of not abandoning your ship. We've done previous Facebook Lives on this that you can refer back to. We've done previous Facebook Lives on how straight A students fail their registration exam, as well as having a plan for test day. This is a pivotal part of our program. Confidence, your emotional readiness can definitely determine your success just as much as your study process can. So you can't really have one without the other. You need all three.
When we developed Empowerment Nursing, we knew our program needed to fulfill these 3 requirements for exam success: content, critical thinking, and confidence. This is why we deliver all the content you need. We teach it in a way that promotes critical thinking throughout our course, and we prepare you emotionally for that day when you are ready to write your exam.
If you're looking to gain all of the content, critical thinking, and confidence you need to pass your NCLEX or CPNRE exam, we have complete NCLEX, NCLEX PN, CPNRE, and bridging packages. We now guarantee that you will pass or your money back. So we hope that these 3 tips, content, critical thinking, and confidence being our number 3 recommendations to how to successfully pass your NCLEX or CPNRE exam, have helped you. And thank you so much for joining us, and we'll see you next time on In the Know. Bye for now.